Hello again, my name is Dr. Ahmed Kumar, clinical lead at Dr. 2U and a practicing NHS GP. After graduating from Cambridge University over 15 years ago, I've amassed a wealth of academic and clinical medicine experience. At Dr. 2U, we like to inform, educate you, and help you along that journey towards becoming master of your health. One of the ways we like to do that is by providing you with good quality, trusted information by way of these videos that we record to help you along that journey. So it would be really good to hear from you about future topics you'd like us to discuss on one of our videos. Now, I want you to remember that what we're going through here today is general advice. It's not about your specific situation. Whilst there's a lot of useful self-help information that you can use, if you've got any symptoms, it's important that you speak to your doctor so you can be given the best management advice for your particular circumstance. What I'd like to talk to you about today is incontinence of urine. Incontinence is the involuntary, unintentional passing of urine. There are various types that we categorize them into. So you have what is called stress incontinence. Now, stress incontinence is the leakage of urine following a sudden increase in your intra-abdominal pressure, so the pressure within your abdomen. And this may be because you've coughed, you've laughed, you've lifted something heavy, you've ran. Okay, this is a lot more common in women, and it's often because of a weakness in the pelvic floor muscles. So these are the muscles that support your bladder and also control the passage of urine from your bladder into your urethra, and then into the outside world. There is also something called urge incontinence. Urge incontinence is when someone gets the sudden urge to rapidly pass urine, and often the urine comes before you can get to the bathroom. So causes of urge incontinence can include, drinking alcohol or having a lot of caffeine. Sometimes it may be because your bladder is actually overactive, so it doesn't fill up to full capacity, and suddenly it just wants to empty whatever is in it. Now, you can have a mixture of the two. So some people have an element of stress incontinence, and some people have an element of urge incontinence. There are other types of incontinence. It's not worth going through all the different types, but there's something called overflow incontinence, and that is when your bladder fills up, it loses the inability to discharge, to get rid of urine that's in it when it's at capacity, and then it overfills. And this can sometimes happen when there is an obstruction to the flow of urine outside of the bladder. For example, in men with very large prostates, so the bladder fills and fills and fills, and all of a sudden it just can't fill anymore, and the urine just starts to leak out. It trickles out constantly, and you're not able to control it. There are lots of other types of causes of incontinence. The most important thing is if you are experiencing this, don't be embarrassed, okay? How common is incontinence? The honest truth is we probably don't know how common it is, because it is one of those quite embarrassing symptoms for patients to have, and as a result a lot of people don't actually present to their doctors. So we don't have a good idea of how common it is. But from studies that have been done, we can estimate, and this is quite a wide estimate, and you can see the variability in different parts of the world in terms of reporting incontinence. It's estimated to be somewhere between 6 to 62% of the population. It may even be much higher than 62%. It's, I mentioned stress incontinence earlier. That's a lot more common in women, and the prevalence, the number of people in the population with it increases with age, so mainly in the over 50s. And also, if a woman has had multiple childbirth, they're more likely to experience stress incontinence later on because of the weakening of the pelvic floor muscles. And there are certain types of incontinence that are common with certain situations, certain conditions. For example, diabetes, because when you have a lot of sugar in the urine, that draws water out and can increase your frequency of passing urine, and that can sometimes lead to incontinence. We also mentioned earlier that if you have a sudden increase in the pressure within your abdomen, that can increase the unintentional leakage of urine. And so if someone is significantly overweight, a term that I don't particularly like using, but if they're obese because they have a raised body mass index, that can lead to increased levels of incontinence as well, because there's more pressure in your intra-abdominal region, in your, specifically onto your bladder. So if you present to your doctor with a history of incontinence, or this again unintentional leakage of urine, what test might you have done? Well, as usual, your doctor will go through asking you several questions, okay? The questions we ask are really, really important in terms of leading us to the diagnosis. We may also choose to examine you. Now, in the case of incontinence, it may be necessary in a woman, for example, to have what we call a pelvic examination. So not just feeling outside, but also examining inside the vagina. And that is to check for any abnormalities, any masses, any swelling, that may give us a clue as to the cause of the incontinence. And during that examination, the doctor may also assess the strength of your pelvic floor muscles. So whilst they have one of their digits within the vagina, they may ask you to squeeze, and the strength of that squeeze can give an indication as to how strong or weak your pelvic floor muscles are. If the patient is a man, your doctor might also want to do an examination of your prostate, which is normally done through a digital examination from the anorectal region, where you can feel the prostate, feel its integrity, its smoothness, and also its size. All of these examinations may be necessary. Now, beyond that, it may be necessary to do further tests in a hospital setting, for example, an ultrasound scan of your bladder or of your female organs if you're a woman. And sometimes, if you're referred to a specialist to further manage your incontinence, you may have very specialist tests done that actually test the strength of the flow of your urine, how quickly it flows, how much urine your bladder empties, as a proportion of how much was in there in the first place. They call this urodynamic test. It gives the doctor a clue as to the likely cause of your incontinence. So once you've been diagnosed with having incontinence, or whether it's stress or urge incontinence, there are certain advice that your doctor may give you. Now, in the first instance, they may actually ask you to do a diary of your fluid intake and how much urine you pass, when you pass urine, and how that relates to when you take fluid. Not just of the amount of fluid you're taking, but also what type of fluid. Is it fizzy drink, water, coffee, so things with caffeine in them. And then there are some lifestyle measures that will help with any type of incontinence that you have, if you're able to modify these factors in any way at all. I mentioned earlier, if you're overweight, especially if you're significantly overweight, in the category that we call obesity. If you're obese, the pressure increases, in your abdominal region, and that can increase your risk of incontinence. So losing weight can actually help. Now, some people, it might be that you're actually very constipated usually. Now, the bladder and the rectum are very closely aligned within us. So if someone is very constipated, that can actually cause a constant, regular irritation of the bladder. And sometimes dealing with the constipation might actually improve your incontinence quite a lot. Reducing caffeine, so I mentioned the diary, so reducing your intake of caffeine, maybe reducing coffee, reducing fizzy drinks, reducing drinks like Red Bull, so these energy drinks. Now, tea has caffeine in it also, so if you don't drink coffee or any of those things, it's just tea, then it may also be really important that you reduce your intake of tea. Now, Beyond these measures, there are medications that may be advised. Okay, I won't go into specific details here, but some of the medicines that are given to control your bladder, so your bladder is not over contracting, so it helps the bladder to relax a little bit more. Now, on the very strict advice, some medications can actually help reduce how much water leaves your kidney. And what they do is they actually retain a lot of the water that flows through your kidney. So instead of going out as urine, it's retained within your body. These are not prescribed lightly. They require a lot of close monitoring of your kidney function and of your sodium level, because they can drastically reduce your sodium level. But that is a discussion to have with your doctor. Are there surgeries available? Yes, there are. Now, for stress incontinence, remember, stress incontinence is where you have the reduction in the integrity of the pelvic floor muscles. So before considering surgery, you would have been advised to do pelvic floor muscle training. So regular contractions is where you squeeze. Imagine you want to pass urine or go to the toilet desperately, but you're squeezing to stop yourself from going. So if you do that periodically, no one knows you're doing it. So you may just be on the bus, in the car, on the train, or just at home. If you do that several times consciously, perhaps every hour, every couple of hours, it will improve the strength of your pelvic floor muscle. But if you've done all of that and it's not improved, then you can have there may be an option to have surgery, and they have something called a sling procedure, and that can help with that. There is also surgery for urge incontinence, and this is often to do with disturbing the innervation of the bladder, so the bladder isn't overactive. And what is the take-home message here? Well, firstly, I just want to say a huge thank you to you for taking the effort and investing time into just learning about your body, learning about your health, and becoming a master of your own health. I just want to highlight that incontinence is very common. Although I recognize it can be an embarrassing symptom, and this can put people off actually presenting to their doctor with the symptom, there is a lot of help out there. There's a lot of guidance that you can be given. There's a lot of things that you can do yourself, but without having the knowledge, you wouldn't know what to do. So this is great, but what's important is you speak to a doctor specifically about your situation, so you can be given the best advice. Remember, incontinence is common. Present to your doctor. There's a lot that you can do. I just really want to thank you so much for watching this video today, and thank you for tuning in to Doctor to You. Please share this information with your friends, your loved ones, your family. We're putting up other videos all the time, so you may find another topic that's of interest to you. Subscribe to the channel. If you have any medical concerns, feel free to contact us at any time at drtoyou.co.uk, so drtoyou.co.uk, or using any of the other contact details that you can see on the screen. Thank you so much. I wish you good health, longevity, and success in your journey to becoming a master of your health.